Hi, I'm Kate Marie and I'm from Slow Aging, and today I'm here with Dr Jason Kaplan, who's a cardiologist and he works at Macquarie University. Hi Jason.
Hi Kate, how are you?
Great, thanks for seeing me. I'm really excited about this consult.
Great, it's a pleasure.
Jason, what is a statin, what is it used for, and what are the common brand names?
A statin is a drug to lower cholesterol. Statins are the most widely prescribed drugs in the world today, and up until a few years ago, Lipitor was the world's most prescribed drug, with millions and millions of scripts being written every year. So Lipitor was the most common. Other statins brand names include drugs like Crestor and Zocor and Pravachol. They're probably the most common statins, though now most of the statins are generic, so they may have different names. So what statins do is they affect a drug called HMA-CoA reductase, and they affect the production of cholesterol from your liver. Statins are very good at lowering bad cholesterol. Some of them raise good cholesterol, and also some of them lower triglyceride levels as well. And in very large-scale trials, they've been shown to reduce cardiac events in general. Now, there's a lot of controversy among statins in the popular media, and probably that's because too many people are getting them that probably don't need them. Now, the group of people that benefit the most from statins are the people at the highest risk of heart disease. And we like to think of it in the number needed to treat. So if you're at very high risk for heart disease, you will benefit from statins, especially if you have cardiac risk factors such as high cholesterol, high blood pressure, a strong family history, or if you've had any sort of heart event or heart attack, or if you have vascular disease, such as a narrowing in the blood supply to your brain, which caused a stroke, or to your legs, called peripheral vascular disease. As we get much lower risk, and if your risk is actually very low, your number needed to treat goes up significantly, which means that you actually don't stand to benefit that much from statin therapy. So statins are great drugs at reducing cardiovascular events, but they need to be used in the right population.
What other things are taken into consideration when prescribing a statin?
I think it's important to take into consideration what other drugs someone is on, and also whether they have the potential for side effects from statins. So often statins get affected by the metabolism of other drugs and vice versa, so it's important to look for drug interactions. Some people do get side effects from statins, and the most common side effect we see are muscle aches and pains. The majority of people can tolerate it. Sometimes the muscle aches and pains can go into something more severe, such as inflammation of the muscle, or even a leakage of muscle tissue, and that is often picked up in a blood test with a blood test called creatinine kinase. Now, the majority of people can tolerate statins very well without any problems.
What can people do about the side effects of statins? Is there some way they can modulate those?
So there are quite a few ways you can modulate the side effects of statins. Sometimes you can take statins on alternate days. Sometimes there's a vitamin called coenzyme Q10 or ubiquinol that in a small study has been shown to reduce some of the muscle aches associated with statins. And what I tell patients is, I think you should give it a go and see how it works in you. So try take it for a month if you're on a statin, along with some coenzyme Q10, and if it makes a difference and the muscle aches reduce, then I would continue it. If it doesn't, then I don't see any point in continuing it. Now, there has been a lot of controversy with statins. Now, the key message I have for patients is that you cannot out-supplement or out-medicate yourself out of poor lifestyle choices. So if you don't make good choices about your diet and exercise and the way we live our life, including stress less, good sleep patterns, then you can take all the statins in the world, but it's still not going to make a difference to your cardiovascular health. So while they're useful at reducing cardiovascular events, they're not the be-all and end-all, and they won't totally reduce your cardiovascular risk.
I know there's a number of factors around cardiovascular risk. On its own, if someone took a statin, is there any way of knowing what percentage it reduces their risk?
The risk of cardiovascular events is often related to the concentration of their bad cholesterol, the LDL, which is one we focus on a lot in reducing. When we aim to reduce LDL with statin therapy, we do know that in certain people who have coronary disease or pre-existing coronary disease, if we reduce your LDL, the bad cholesterol, to under 1.8, we can even reverse heart disease. So we can take plaque that is in the arteries and start to thin it down and even take some of it out, which is pretty amazing. Now, it is fairly difficult to get your LDL down to that level without statins. There are some people that can do it on a more plant-based and vegan style diet, but for people at highest risk, statins are very effective at doing that.
Jason, who shouldn't take statins?
Well, I don't think you should take statins if you are low risk for any cardiovascular events over the next 10 years using the traditional risk score calculator, or if you don't have the presence of plaque in your arteries as tested by a CT coronary angiogram or a coronary artery calcium score. This suggests that you do not need statins to lower your cholesterol, and you should use diet and lifestyle measures to lower your cholesterol, and you are safe to do so.
Thank you, Jason.
Thank you, Kate. Thanks a lot for coming to see me.